Hi everybody, hope you're all keeping well. So today I'm going to do a brief video on some of the mental health professionals and their roles. So if you do reach out to either Sporting Chance or Changing Minds, what might you expect when you get put in touch with the support services? So the first one I'm going to look at is the therapist, the counsellor, the psychologist. So this is where most of us start off in terms of trying to work through some complex emotions or complex situation or experience that we might find ourselves in. So the starting off in terms of counselling or therapist is generally called talking therapy. So it's basically giving us the space to completely unload whatever it is we are experiencing at the minute, and there's no judgment. That's the great thing about therapy, is that therapists they're not there to judge, they're there purely to help you. And that can be quite a relief if you are going through something particularly challenging, that you can completely unload, tell them exactly how you feel about that situation. And that in itself can help with a lot of relief and help you start kind of working through that complex emotion, the complex experience. So the therapist or psychologist, counselors will kind of just keep reflecting back on you and kind of what you're saying, how you're interpreting the situation, and find a way of working through together. It's very much a sort of partnership. It's a back and forth. They'll keep reflecting back on what you're saying and get you to think a little bit deeper about it and work through some of these challenges. So that's the sort of talking therapy approach. Within that, there's lots of different kind of ways people have been trained and have different skill sets. So the classic one, or one of the most commonly used one, is the psychodynamic approach. So what that does is it looks at our past experiences and relationships, situations, etc., and how they influence or affect how we're currently approaching maybe a current situation. So it could be looking back into our childhood, or if we've had particularly traumatic experiences along the way, looking to see how we've kind of processed them, and if there is in some aspect that we haven't processed them fully or haven't process them in a healthy way, that can be causing some internal conflict. And that can cause a lot of anxiety when we face a current experience that we don't really have the tools to fully kind of process. So the psychologist or the counsellor or therapist will help the person resolve some of those inner conflicts that might have kind of arose many years ago or in childhood, and then that will provide a little bit of relief and give them a bit of a better sort of toolkit to go into the current experience or situation they're dealing with, and again help them work through that. The next one we're going to look at then is the clinical psychologist. So again, grounded in that sort of talking therapy and being really open and honest environment, no judgment. But what a clinical psychologist, some of them get trained in, is the CBT approach. So this is cognitive behavioral therapy. So cognitive is the sort of thoughts that we have in our mind, the inner dialogue, and then behavior is how we act in the world. So what the clinical psychologist might do, or the CBT trained therapist might do in this situation, is look at our current thoughts and see how they're affecting our behavior. So if the current thoughts are negative or unhelpful, they'll look to explore those thoughts and see if they're associated to maybe some fixed negative belief we have about ourselves. If they can kind of, obviously you're going to work together, but the psychologist will help you kind of reframe, restructure those current thoughts in a more positive light, and that will help kind of change and make those fixed beliefs about ourselves a little bit more adaptable, a little bit more helpful, a little bit more positive. And that in turn then will help our approach in terms of going through whatever challenge, experience, or helping kind of approach life in a bit more of a helpful manner. The last one then I'm going to look at then is psychiatry. So again, this is grounded in that kind of open environment, open space, honest space, non-judgment. The psychiatrist may be trained in one of those other areas, the CBT or psychodynamic, but they'll also have the option of medication. So medication has a bit of a stigma to it. When we speak about medication, we're talking about antidepressants, anti-anxieties, medication predominantly. As I said, they can have a bit of a stigma to them, but they can be incredibly helpful to people who are really struggling. They can just take the edge off that negative emotion, allow that person to have a little bit of a breathing space, give them a little bit more of a clear mind to help them then talk through some of the challenges or those complex emotions, experiences that they're going through. So there's plenty of people who have taken medication in the past and have found it really beneficial, really helpful. So it's definitely an option that is there for someone, as I said, who is significantly struggling. The last thing I want to talk about very briefly is just giving it time. So if you are if you do reach out to a support service and you see a person for 1 or 2 sessions and you're not finding immediate benefit from it, that's okay, that's normal. The therapist client relationship is so important to imagine talking to a friend. You're not maybe going to be on the same level straight away. It maybe takes 1 or 2 conversations, 3 conversations to really develop that trust, develop that kind of relationship. So if you do feel that you're maybe not getting an immediate relief from these issues straight away, sometimes you do. Sometimes it takes a little bit of time, and it's to be really patient with that and give it 4 or 5, 6 sessions. Sometimes you just don't click with a therapist or a counsellor or psychologist. It just doesn't work for you. That's absolutely fine. Just because it doesn't work with one person doesn't mean it won't work with someone else. And again, if you're just open and honest and say to that therapist, look, I appreciate that your time, but this isn't working for me. Is there someone else who might have a different skill set who I might gel with and help me work through these experiences with a little bit a bit better? Thanks very much for watching. As always, the support services will be on the slide that follows, and I will catch you the next time. Bye bye.